Thank you very much again for joining. We have a very exciting session lined up this afternoon. My name is Zabi. I work with UNICEF in the Immunization Supply Chain Unit, and I have the pleasure of introducing our panelists today, who Dijana Spasenoska and Maarten Jansen, who would take us through the tools. They have these two innovative country-led and country-owned initiatives that they will take us through. So Diana works in the Department of Immunization, Vaccines, and Biologicals at WHO headquarters. She has developed the innovative framework that we will have a look at in a minute. Diana also co-developed the WHO's guidance for conducting situation analysis of immunization program performance, and she's currently supporting its implementation in country offices. Diana has a bachelor's in biochemistry from Imperial College London and a master's degree in global population health from London School of Economics. Currently, she is finalizing her PhD in demography and population studies at the London School of Economics, researching the impact of political and socioeconomic changes on population health and mortality. We give them a round of applause for them. Maarten has a master's degree in biomedical sciences from Radboud University in the Netherlands and a PhD from the same university. He worked on different projects related to priority setting in healthcare, health technology assessment, and health benefit package design, with a focus on supporting Ministry of Health advisory committees in low and middle income countries, including in Indonesia, Kazakhstan, Iran, and Pakistan. Maarten joined WHO headquarters Immunization Analysis and Insights units in 2021. He is the project manager for the innovative CAPACITI initiative that he will present here for us in a minute. Please give a round to Maarten. So without further ado, I'll hand over to Maarten. You were going first. So to Diana to take us through it.
Thank you. Hi, everyone. So today's presentation, we have two parts. The first one will be focusing on the priority settings of vaccine innovations, or what is also known the CAPACITI Innovation Framework. And then Maarten will present the Capacity Decision Support Tool. So first, we start with the priority setting of vaccine innovations. This work really started when looking at the full value of vaccine assessments that has been developed. These assessments look at the whole life cycle of the vaccine, and at each point they really encourage to look at the full value of vaccines through engagements with different stakeholders as well as countries. You can see there are many key questions, and the tools and the tool and the framework that we're presenting today are looking at two questions. So, should we recommend or fund a vaccine, and should we introduce a vaccine? Just for the note, we will use vaccine to refer both to the innovative vaccines, but also vaccine technologies. So we'll use them interchangeably throughout this presentation. So what has been the challenge with innovative vaccines or vaccine technologies? Well, insufficient understanding of country needs and preferences leads to product designs that do not meet country needs and preferences. And this could result in uncertainty in demand of the innovation, but as well as poor uptake of the said innovation. So we as WHO have decided to focus on country-level engagement to assess how this product would be used and what are some of the critical product attributes for uptake. So really putting the countries at the forefront and having their voices be heard throughout this process, where then we will take those findings and communicate the preferences to global vaccine stakeholders and manufacturers as well through different avenues. And as you can see here, for example, a target product profile that is published for an innovation, or maybe a journal article publication. So the Capacity Innovation Framework has three main purposes. So the first one is to evaluate the vaccine product innovations to clarify what is their perceived value and acceptability requirements in the countries. It also facilitates deliberations and communications between stakeholders from diverse levels and disciplines within the immunization system to agree on what are the programmatic implications of the innovation's attributes or characteristics. And it seeks to identify criteria and evidence needed for the decision-making processes in the future when this innovation becomes available in the markets, and they need to decide, whether to use the innovation or the current practice. The users of this framework are WHO and partner organizations, as this is a platform for engagement with relevant stakeholders, such as the Ministries of Health, NITAGs, FDAs, or other national stakeholders. And it can be implemented as a single or a multi-country workshop. So the discussions can look at the national viewpoints, or they can compare multi-country viewpoints within one workshop. So far, we have conducted several pilots in Afro, Sierra, and Pajo. And we have developed Excel-based workbooks where we are documenting these workshops. And currently, we have used it for 3 innovations. So we have used it for measles and rubella microarray patches, thermostable vaccines, and oral cholera vaccine capsules. The Capacity Innovation Framework workshops have 5 objectives. And they really go in a stepwise process to achieving these objectives. And I will describe the steps in the next few slides. But the first objective is to determine and to prioritize what are the specific immunization barriers that can be impacted by changing the way a vaccine is delivered. And these barriers would be vaccine specific. So, for example, the priority of certain barriers might not be the same for vaccines looking at measles and rubella, or maybe vaccines for cholera. Then the second objective is to identify the critical product attributes for the innovation to reduce or eliminate those prioritized barriers. So what innovative features of these innovations could help to reduce or eliminate those barriers? Then we're looking to understand and validate potential use cases for the innovations and how they could be used in the countries once they're available. We want to identify what would be the likely data that countries will need to be able to make evidence-based decision in the future. And last but definitely not least, we use these workshops as an avenue to familiarize stakeholders with the innovations that are being developed, the attributes and the results of development, and the potential for uptake in the immunization programs. So there are 5 principles upon which we build these workshops. The first and most important is that these are country-driven. So during these workshops, we really put the emphasis on hearing the country voice around the assumptions that we are making around the development of these innovations. So country stakeholders are validating these assumptions that are used in the development of these innovations. Second, they're structured and evidence-based. So they're a systematic approach that allows for reproducibility and comparability between the different workshops. They're evidence-based, as they're using the most recent evidence base that is in the country through the input from country stakeholders, but also the evidence that is already available in the country. They're transparent, so they're credible and transparent consensus-building processes. And lastly, but also very importantly, they're a partnership. They're a partnership between the global level, regional level, and country level. And then even within those levels, they're a partnership between different stakeholders that work across the immunization system. So here we have the steps of the workshop. So there are 4 steps that we are conducting during the workshop, and there is one pre-workshop preparation. The pre-workshop preparation is the work done around identifying relevant barriers to immunization that exist in the country. And for this step, we're using the WHO guidance for conducting a situation analysis of immunization program performance. This guidance has a very detailed workbook that divides potential barriers that could exist in countries across the 7 EPI categories, putting them in very specific phrasing. And by conducting this desk review using this workbook, it allows us to collect information on barriers across countries and compare them using a standardized language. And this is really important with how we present the findings further. So once we have conducted the situation analysis through reviewing the already existing information sources in the countries, then we go to the workshop. During the workshop, the very first step is to prioritize those identified barriers in the context of underserved populations. Here, the emphasis is on the diversity that exists at the subnational level, and each of the countries has the opportunity to identify however they want to define those contexts. For example, in Indonesia, those contexts were the different groupings of islands based on their socioeconomic development, while in Uganda, those contexts were populations that have some similar characteristics, such as fishing communities, mountainous regions, nomadic populations, refugees, or people living in urban settings. The prioritization is relative, which means that out of the long list of barriers that are present in the country, the participants, through a consensus-building dialogues in breakout groups, they determine what is the relative priority of each of the barriers for the context that they are discussing. And we have seen that there is quite a lot of diversity between priority of barriers across the settings, even within one country. The second step is to then link those barriers to innovation attributes. So based on the target product profiles of each of the innovations, we have identified characteristics that are specified for these innovations. And we're asking the participants to decide how do these characteristics affect the barriers they have identified. We're not only looking at, the positive effect, the reduction or elimination of barriers, but we also want to understand, do any of these features and attributes of innovation affect negatively the barriers? Or maybe they pose an indirect challenge or an indirect benefit that we need to consider. Then we're looking at understanding use cases, and here we're asking what would be the most suitable application of this innovation in your country. So, for example, in relation to a lot of the conversations that we were hearing yesterday around community health workers, would an innovation such as MR maps then be potentially delivered by community health workers? How feasible is this, and how desirable it is in countries? Finally, the fourth step looks at determining the criteria for decisions and feasibility of proposed implementation strategies. And this is a very important step because we're asking the participants to imagine 10 years from now, for example, when an innovation is available, how would they decide? What criteria would they use that looks beyond cost to decide whether to use it or not? And most importantly, what evidence they will need to make that decision? This will help us to prepare for introductions of innovations by generating the evidence. And this is not only global partners, but also some countries have expressed interest in participating in those efforts to generate evidence. So as I said, we have already conducted several workshops in countries, as you can see here. We have conducted workshops around MR maps, thermostable vaccines, and oral cholera vaccine capsules. We just finished the Bangladesh workshop last week. The way we select the countries for engagement has been looking at certain characteristics such as Immunization Agenda 2030 priority country based on the number of zero-dose children, or maybe some very specific characteristics that could provide a unique perspective, such as local production of vaccine and so on. Each of the workshop has around 30 to 50 different participants, and you can see the list of stakeholders represented is quite long. So we're looking at Ministry of Health, subnational representation, National Immunization Technical Advisory Group, academia, partner organizations, and so on. The user feedback that we have received so far is very positive and very encouraging. Countries have told us that the Capacity Innovation Framework workshops are a suitable platform to assess innovations, and we have received continuously positive feedback. So we are conducting surveys at the end of each of the workshops, and you can see some of the feedback. Participants think that it's well structured, informative, it allows them to express their opinion, and they really appreciate the opportunity to discuss the barriers that exist in the country as well as the potential of the innovation to address those. Here, I want to briefly show an example. In the interest of time, we cannot show all the findings that we have from these workshops, but they will be published in the future in papers. But here, I am showing an example of MR Maps findings and how these can help us to achieve these objectives. So you can see that we have found out that MR Maps could address multiple immunization barriers. So for example, barriers around transport and delivery of vaccines. Then the attributes such as single dose presentation, easier administration, or thermostability are some of the most important attributes to address these barriers. Then the ability of community health workers to deliver MR maps has been seen as a positive use case and a desirable use case in the countries. And we have seen that countries would be interested to conduct pilot introductions in the future, as well as to participate in acceptability or feasibility studies as well. Overall, they said that well-planned communication and MR map introduction strategies and guidance would be needed to ensure successful implementation. Finally, how we will be using these findings. We want through this framework to introduce some efficiencies as well. So we want these findings to be used for different purposes, not just to answer the questions around the innovation. And this structured and systematic approach really allows us to do that. So here we have highlighted some of the areas of how we can use these findings. So for example, strengthening programs, the work that is done around understanding the barriers of immunization and the evidence gaps that exist could be used then to inform national immunization strategies in the future, or as questions, for example, for an EPI review. Then these findings can be used to set national research agenda, not only at the programmatic side, but also research around the feasibility of these innovations to be used. It could help us to optimize introduction in the future by considering the policy, programmatic, and procurement considerations that we have discussed. It helps us to generate innovation evidence and to overall optimize product development, as it raises awareness on innovation progress at all three levels. So this is my last slide to summarize. The Capacity Innovation Framework workshop is a platform for country engagement through multi-stakeholder dialogue. It assesses the innovations program impact and how it would be used. To date, it was used for several innovations across 10 countries, and we have engaged so far with more than 220 stakeholders, receiving positive feedback on the framework. Further refinement and additional applications are planned, and we're really looking forward to hearing from you if you see any use cases of this innovation framework to support the work that you're doing. Thank you, and I'll hand over to Maarten.
Okay, thank you. Hello, everyone. For this second part of the presentation, we're going a bit more downstream in the vaccine life cycle. So as you can see on this slide, Dijana talked a lot about innovations that are still in development. And now for this part, we're going to look more at a tool that was developed really to help countries decide on whether or not to introduce or prioritize some of these products that ultimately become available for countries to implement into their programs. So I want to start with this slide that basically presents some of the challenges that countries face as these new products become available. So as you all know, healthcare decisions are of course complex. And the question really is, how can you assess the alternatives that you have for introduction, for example, and based on the relevant evidence, make a good informed decision. So there's often many options that you can consider at the same time, and I'll come back to some of these options. There's often many factors that impact the decision, and we've heard a lot of presentations talk about cost effectiveness, budget impact, some safety concerns, and there's of course many more other factors that you might want to consider as you try and prioritize which options are actually best for your program at this specific time based on your own context. But of course, there's also multiple viewpoints, and there's always different stakeholders that each bring in their own perspective and have their own preferences in terms of which of these products should be prioritized for different reasons. And then, of course, as with any decision, there's always unperfect data. Often, a lot of the data that you would like to have is not available for you to really make your choice in the most informed way that you would like. So you somehow also need to deal with that aspect as you make these decisions. So what I will talk about in this part of the presentation is the capacity decision support tool. It was a tool that was developed in response to a request by countries to get guidance on, in particularly prioritizing among multiple immunization products, services, or strategies. And I'll come back to this. But it really has been developed to incorporate input from multiple stakeholders. As I mentioned, multiple perspectives, but also to combine different types of evidence that may come from different disciplines and from different health system levels, but also from operational and socio-ethical aspects. But it will also help countries consider data uncertainties as they try to make these decisions. What it really can help do is also document country preferences and drivers to decision making as countries use this tool to make decisions. Over time, it can also help identify what the driving factors are for countries to make specific decisions when they face specific prioritization questions that are similar. So in that way, it can also help flag to the regional and global community what evidence needs are and which gaps there are to really help countries inform decisions that are similar. So in terms of the end user for this particular tool, usually there's a country team that coordinates the recommendation or decision-making process in a low-middle income country. It could be, for example, that a NITAG is asked to make a recommendation that involves prioritization, but it could also be different groups that work together and try to organize a decision process where it's a more ad hoc committee that is established. So it can be different groups. It can be used for policy and programmatic questions. So it's not just high-level questions, but it can also be more operational. And in terms of how it was developed with 12 countries in Africa, Asia, and the Americas that gave input into the different versions that were developed over time. And it has been recommended by WHO's Immunization and Vaccine-Related Implementation Research Advisory Committee, IVRAC, for using countries to support with prioritization. So when we talk about prioritization, I just want to take a minute to think through what we actually mean with prioritization. So there's different types of prioritization questions. Some of these can be more about selecting one option and not selecting other options. So it could be, for example, around product choice, where you have different products that you can choose. And you want to compare these different options and really select one that you would then ultimately implement. It can also be a schedule choice where you have multiple options again. It could be different delivery strategies where you basically select the option that is best for the context at the time. Then there's other questions that are more about ranking multiple options. So there it's more, for example, about vaccine prioritization. So if you, for example, face multiple new vaccine introductions that are coming your way, and you may need to prioritize which of these vaccines do we introduce first. So for example, HPV, rotavirus, or PCV. Or do we perhaps combine some of these to create synergies and prioritize them together and then sort of go on to the next? And then there's also, for example, vaccine introduction or delivery strategies. So maybe you're considering rollout strategies where it's a bit more phased. You want to prioritize certain regions for introduction, and you want to choose between which region to prioritize first and then which next. But it can also be prioritization of immunization and non-immunization alternatives. So for example, investment in a rotavirus vaccine introduced compared with other diarrheal disease prevention and control measures. So it's not just looking at immunization products in isolation, but it can also be broader. So maybe just the takeaway from this slide is that it can be a lot of different things that you can compare, but the usefulness of this tool is always when there's multiple options that you are considering side to side. So we talk about the Capacity Innovation Framework and the Capacity Decision Support Tool, and the reason that they're both called capacity is that they're based on the same shared principles. So the Decision Support Tool is also country-driven. Use of the tool is really led by a country team, and also it's not pre-filled at key points in the process. So the country is really flexible to basically, based on their own context, make decisions about what they want to consider, what the decision questions should be, which options they are comparing, but also in terms of which factors they want to take into consideration as they make their decision. It's also a structured approach, and we have an Excel-based tool that really guides users through a consistent and reproducible 5-step process, and I'll show a bit more about that in the next few slides. There's really a focus on making an evidence-based decision. It's based on multi-criteria decision analysis, and I'll also show a bit more about that in the next few slides, as a systematic way to really incorporate different types of evidence for different criteria that you might consider in your decision-making, but also to bring together different stakeholder perspectives in a deliberative process. It's also transparent, so it really helps with developing a recommendation that's then really explicit in terms of why the decision was made, what was considered, which evidence was considered, and how it was brought together to ultimately come up with a prioritized product or an order of introduction, for example. And finally, it really encourages partnerships to be formed at the country level. So it really encourages users of the tool throughout the process to get together and to deliberate around what the important elements are to consider, but also to bring together different expertise. So this is just a short overview of the steps that are in the Capacity Decision Support Framework or in the tool. So it starts with a decision question where you basically focus on the question that you will be addressing, but you also think about what the options are that you should consider as you do your prioritization. Then once you have your decision question and the options that you want to compare, you can go on to the second step, which is thinking about the criteria and the factors that you would like to take into consider for this particular decision. And it can be a default list that some of the groups that already exist use. So for example, NITECs already have sort of standard frameworks where they have standard criteria that they consider. But for some decisions, it might be better to sort of expand that list or to revisit a different list or create one from scratch to make it more contextualized for the decision. But once you have your criteria and you know what factors you want to consider in your decision making, you can go to evidence assessment, where you basically go and summarize the evidence that is available, or you may do some studies depending on how much time you have for your decision process to fill some of the evidence gaps as part of the process. And then the fourth step is appraisal. That's where you really look at all the evidence that you've summarized, and you try to make a judgment on which of the options is performing best. And you try to look at trade-offs between the different options. You try to understand, based on our context, which option would be the best way forward. And then finally, there's a fifth step, which we call recommendation. And that's really where you think ahead and you formulate your recommendation, but you also think about supplementary recommendations that you can make to ensure the success of the implementation or the recommendation going forward into the actual operational levels of decision making. So that's the 5-step process. And as I mentioned, there's an Excel-based tool that countries can use, and there's a lot of guidance inside the tool, but what it really helps groups do that use this tool is really to come together and to deliberate around each of these steps and really come up with a shared understanding of what is needed at each point of the process. So even though there's an Excel-based tool that countries can use to document their discussions, what it really promotes is for groups to come together and to really together decide on what they want to do next. So this slide is just some examples of how the decision support tool has been used up to this point. So on the left-hand side, you can see the example of Indonesia, where it was the EPI and the NITEC together focusing on new vaccine introduction planning to inform their CMYP process, which is currently replaced by the NIS. The National Immunization Strategy, where they looked at scale-up scenarios for rotavirus, HPV, and PCV, and they wanted to select scale-up scenarios for introduction into the EPI program. And the result of using the decision support tool was that they had a recommendation or prioritized scale-up scenarios for these 3 vaccines that they then recommended to the Ministry of Health. So in the middle, there's the example of Mali, which is a different example. So there it was the EPI, the NITEC, together with the Directorate for Public Health, together in the context of doing a Gavi application, looking at different products that they could introduce for a specific vaccine. So they looked at Cervarix 2 doses, Gardasil, and Cervarix 1 dose, and they tried to prioritize which of these options would be best for their context. And as a result of using the tool, they had a better justification for their product choice to Gavi. So it helped them in their application. So on the right-hand side, there's an example from Ethiopia. So in this case, it was the Ethiopia Public Health Institute that drove the process. And they tried to look at optimization of MCV coverage to increase coverage and some options that they would have. And the question here was more, should we switch from a 10 dose to a 5 dose file size? And ultimately, they made a recommendation to collect additional evidence on cost effectiveness. That was one of the important outcomes at this time. So there's different ways of using the tool. As I mentioned, there are 5 steps. But depending on how they want to do their appraisal, so their discussions around the evidence that they've summarized, you can either skip some of the sub-steps or you may need to do some additional thinking around, for example, adding weights to criteria to indicate their relative importance. But as I will show in the next few slides, I will show the difference between different ways of actually using the tool. So here's an example of how the tool was used. So for example, when thinking about scale-up scenarios for HPV, PCV, and rotavirus introduction, in this particular case, for the decision question, you first think about the context. And in this case, it was unclear whether a quick rollout of rotavirus and HPV with nationwide coverage would be preferred over a more gradual scale-up of either HPV or rotavirus, or maybe both, with a delayed nationwide coverage in 2 years at a 2-year later point in 2025. And the decision question that they focused on in this case was, what is the preferred scenario for scale-up of rotavirus and HPV alongside introduction of PCV with nationwide coverage by 2022? So some of the criteria that they looked at are listed here on the right-hand side, so as part of the second step. So they felt it was important to think about the avoidable burden of disease that each of these options would result in. They looked at impact, local production capacity, cold chain capacity was very important to them, and it's of course also much discussed during this conference. Vaccine availability, the level of wastage that would result from these introductions, whether or not it would fit into the schedule, adverse events, community acceptance, cost effectiveness, and budget impact. But this is just to give you a bit of a flavor of all the different kinds of criteria that you might consider as part of this process. And for each of these criteria, you need to define an outcome measure that you would look at when you're going through this process. So once you have your list of criteria and your outcome measures of interest, you can then go on to the next step, which is assessment which is when you look at evidence collection and you try to create a performance matrix. So in evidence collection, you really identify, analyze, and record available evidence. And the performance matrix is basically a higher level summary of these evidence statements. So it's not new information, but it's just very high level that you can use during your discussions in the next step. So in the decision support tool, there's a lot of guidance on how to write these evidence statements. So here you can see an example with, on the left side, a criterion cost effectiveness, for example. You can then write a short statement based on the available literature that you've identified. And then there's also space to make a note on the confidence that you have in that particular evidence. So you can present that back to the committee, and you can also fill in the references that you found or the data that you've used. There's also a standard format for a performance matrix, which is not introducing new information, but it's just a higher level summary that you can then use to discuss within your committee which of the options is performing best. So here you can see product A and product B side by side, and you can see some of the criteria on the left. So it's vaccine efficacy and supply availability. And for each, there's a very high level summary of the performance. And there's also a statement on the evidence quality so that the committee can really very quickly see what evidence is available. So the fourth step is appraisal. And this is really where you either discuss, based on the evidence statements and the performance matrix, which of the options is performing best in a structured way. So you either go criteria by criteria to identify from a criteria perspective which of the options would be preferred. And then once you've gone through each of the criteria and you've tried to identify which option is performing best, you then take a holistic look together with the committee to see holistically which of the options would be preferred or which order of introduction would be preferred. But there's also the option to use some of the visual aids that are built into the tool. And here on the right-hand side, you can see one of these visual aids where for each of the criteria, the committee members also gave a weight to indicate the relative importance of the different criteria. So as you can imagine, some criteria may be more important in your decision-making compared to others, but they could also be equal weights. And then also there are scores that are represented here by the colors. So in order to calculate total scores for each of the options, you could use a scoring scale, for example, on a scale of 1 to 10, that you define together with your committee to basically use the evidence to give a score for each of the criteria in terms of their performance. So if, for example, you look at cost effectiveness, if it's very cost effective, you give 10 points. If it's not cost effective at all, you give 0 points. And if it's somewhat in between, you could give 5 points, for example. And if you do that for each of the criteria, you can then use this visual aid to really guide the discussions within your committee so that you can easily trade off, or you can at least see where the differences are in terms of performance. But also you can easily see if there's perhaps unacceptable performance for some criteria or not. But this is optional. So you can either use the evidence statements and the performance matrix, or you could use these visual aids. And then importantly, there's also an option to deal with data uncertainty. So if you, for example, use the visual aids, you can also change some of the weights if there was disagreement between the members in the committee, and you can also change the performance. So if there's a lot of data uncertainty, for example, around some of the estimates, you can easily change it. And at the top of the graph, you can see the alternative total scores, and you can see whether or not that would flip the preference for some of these products, or if the order of introduction would perhaps change slightly. And of course, this is just meant to stimulate the discussions between the members in the committee. So it's not meant to be guiding, but it's meant to really support the discussions. There's also some guidance on using decision rules. So for some of the questions that you might try to answer with the decision support tool, you may already know that there are some knockout criteria. So for example, if you have a cost effectiveness, if you want to consider it in your decision making, and you know there are some thresholds, you can use it to already look at your options that you have available and to use cost effectiveness to already deprioritize some of these options before you go into the broader process. So on the left-hand side here, you can see that the options have been reduced from 6 to 4. You can then look at the other criteria, and sometimes it's useful to use budget impact only at the end of the process, if you know that you have a specific budget impact beyond which you cannot go. So you can then use the budget impact criteria to really select those options that you can feasibly implement sustainably within your program at the end of the process. The final step, the recommendation step, is more about developing the final recommendation and thinking ahead about supplementary recommendations that you would like to consider to the Ministry of Health, for example, if you're making the recommendation for them, and to really document any evidence gaps, etc., that you've identified in the process. So finally, I just want to say a few things about the feedback that we got from Ethiopia and Indonesia. And some of the benefits that they identified when using the process. So the first one is the approach really provided them with a deliberative and inclusive process. So that was one of the important benefits that they felt this tool brought them. And then the second one is that the MCDA approach really encouraged users to consider a broader set of criteria than they would normally consider, because it really asks the users and the members of the committee to be explicit about which criteria they consider, and to think carefully about what outcome measures they would like to consider, etc. And finally, the stepwise approach helped identify and make explicit important evidence gaps, which can then also contribute to research agendas, both nationally, but also regionally, and then ultimately globally. So this slide is just some feedback from some of the regions. So in PAHO, there was a workshop focused on evidence-based decision-making, where they recognized the value together when used in synergy, for example, with PROVAC, the PROVAC initiative that also supports evidence-based decision-making. In the Sierra region, they also felt it was very useful to support prioritization of new vaccine introductions. And they're also considering integrating it into a Sierra framework for new vaccine introductions, positioning it as a tool that could be used as part of their NIS process. And in the Afro region, they also felt this methodology could really help them with some of the challenges they face, particularly in the region, and really help countries think through the options that they have and the criteria that they would like to consider. So finally, there's a use for these findings to strengthen programs, to set national research agendas, but also to optimize introduction decisions, for example, around new vaccine introductions, optimize product development by using the country feedback to also, again, inform product development, but also to generate evidence. And finally, as a final point, there's also a decision-making resource catalog available that can really help countries in their evidence assessment. So once they've identified their criteria and their outcome measures, and you need to identify evidence, you can then use this resource as a first entry point to identify some of the guidances and some of the evidence that's available. And the nice way about this resource is that it's integrated into TechNet, and that the resources are grouped by criteria for decision making, so that countries can really quickly identify some of the main resources available. So I'll end there. Yeah, maybe we just open for questions.
Thank you very much, Dijana and Maarten, for this excellent presentation, and for the sharing a glimpse of the amazing work that you are doing on the capacity framework in the decision support tool. So please, we have about seven minutes for questions. Yes, please go ahead.
Thank you very much. Very exciting and insightful and interesting presentations. So I think I have a question for Maarten. I just want to I don't know whether you are aware, but I think there are a number of tools that have been developed in this sense. One is a target policy profile that was developed by BMGF that is very aligned to the target product profile. And I think BMGF is systematically using the target policy profile now to guide clinical development. So when they fund clinical trials right from the state of inception, they kind of recommend developers, product developers, researchers, and investigators to also consider the policy considerations, the pathway for introducing this intervention into public health systems. So that is one tool that is already existing. And then the second one, I think, is was developed by WHO. So I think I don't know whether you know. There's one of your colleagues called Gite. I think she's like the lead. She was the lead, but I also happen to be like a member of the working group. So they called it like a evidence consideration for vaccine. Is it introduction something of that sort? But it actually mirrors the Bill and Melinda Gates target policy profile. So most of the elements that you have highlighted here are actually contained in those tools. And one of the reasons why they actually developed that tool was really to guide manufacturers and also decision makers in country to develop like a second generation TB vaccine that is gonna target adolescent. So I think the tool already exists, and I think those are like resources that can complement this. But I think from maybe a practical point of view is how which tool do we actually recommend to governments, so that we don't overburden the healthcare workers or the decision makers.
Can I reply first and then over to Dijana, because I think we will. Oh yeah, or we can collect more questions. It's also fine.
Thank you very much for the excellent presentations and very inspiring, actually, for all of us. Maybe I will start with Maarten. I think the decision support tool is very powerful, I would say very strong. So thank you very much for sharing with us. And I would say that probably because it's Excel based, right? It's an Excel based tool. I was just wondering to which extent you already envision building the capacity of countries. Could be NITAG members, could be National Logistic Working Group members, whatever the groups that are supposed to provide strong recommendation to the decision makers to take the right decision based on evidence, for sure. So the main point is you have tools, and you know that anything that you want to do is about people, process, tools, vision, and at country level, I would say. So to which extent you envision to train or to build the capacity at national level and subnational level, even I would say, because you know that now we are looking at even subnational logistic working groups capable to take the right decision. So what is your plan for that? The second point is about to which extent the tool is also to measure the level of application of the recommendation, because you can provide excellent recommendation with rational evidence, everything, but the government or the decision makers may not take into consideration your recommendation. So to which extent the tool is also documenting the low level, I would say, of application of the recommendation. Then for Dijana, I really enjoy your presentation. Thank you very much. And I think that because if I understand the tool, the support here is to conduct some workshop. It's really like inclusive engagement, inclusion of all the stakeholders, partners, government led, to really ensuring that any innovation is currently verified as suitable, I would say. Now I would like to ask you the question, can we use the same approach for systematically address all the barriers? Because here you bring innovation to verify, but here, because I think that there is a need at country level to identify the list of barriers regarding immunization equity coverage, let's say. Yeah? So it can be HR, can be supply chain, can be demand generation, whatever. In this case, when you have the list of all the barriers, to which extent you can put in front of all the barriers existing innovations. And I think that there is a gap here. We are not capable today to put together all the innovation already introduced at country level, proven, tested, verified, and so on. So I don't know how you can upgrade maybe this approach to systematically bring innovation at country level, utilizing this approach. I think it's excellent, but maybe focusing on only innovation to look at which barrier is going to address, I think it's a little limited. But if you have more comprehensive vision, and I think that FPP, EIF exercise with the analysis, situation analysis, or the IRMA card is currently going to this direction. So I would like to learn more with you. So I will discuss with you later on. Thank you very much.
I know.
Sorry, just one. The innovation attributes. Innovation attributes.
Can I quickly reply to some of the questions very briefly, because I know we're already over time, so we have to wrap up. But maybe just to reply, so I think the target product profiles, they're really useful to guide sort of the development of the products, and hopefully manufacturers develop their products in line with these TPPs. But there's still, I think, a need to go to countries and really ask them what their preferences are, because they're defined in a way that there's still a lot of differences that you can do in your design that ultimately are not already part of the TPP in terms of how it's defined, which I think is, so it's a different, and once the products become available, you then need to prioritize what do I do first, which is where this decision support tool, for example, is more focused on, which is slightly a different type of question, I think. But ultimately, hopefully, the products that you have available are already in line with the TPP and the preferences of the countries. So in terms of the capacity training plans, so we're really trying to build on other initiatives. So to make it available through, for example, the NITEC network, the global NITEC network, and to perhaps develop something there. We're discussing with the NITEC team, and then also we're working with the regions to really put them sort of in the driver's seat to actually help countries ultimately implement this tool, and to be available if there's other questions that they would have, or other preferences in terms of how it's developed. And then ultimately, I think also in terms of application, so I think one of the aims for this type of approach is that one of the benefits is that you are better able to communicate to your Ministry of Health what the value is of some of these interventions, and why you prioritize specific options and not others. So in a sense, it helps you as a group to communicate your preferences.
Thank you very much, Maarten. And please stop them in the corridors for further discussion. I can see the people from the next session is here. Do we have time for one more question? No? Okay, we can have a discussion bilaterally. Please give another big round to Maarten and Dijana. Thank you very much.